Welcome to Central Michigan University's panel discussion on COVID-19 vaccine safety and efficacy. I'm Kate Worcester, Director of Strategic Communication at CMU's College of Medicine. Joining me today are a panel of CMU health experts, Dr. George Cacano, CMU's Vice President for Health Affairs and Dean of the College of Medicine, Dr. Delisha Pruitt, a family medicine specialist with CMU Health and the medical director at the Saginaw County Health Department, and Dr. Nicholas Haddad, an infectious disease specialist and program director of the internal medicine residency program at the CMU College of Medicine. So thank you to all of you and to our CMU community members who submitted questions in advance. In the interest of time, we consolidated similar questions. If we are not able to get to your specific question in this panel discussion, you may receive an email response. Let's get started. Let's begin with what people should know before they get vaccinated. These vaccines were developed quickly and approved by the FDA for emergency use. Dr. Cacano, can you address how that was possible, and are these vaccines safe?
Thank you, Kate, for the question. We're talking about vaccine safety and how fast they were developed. This is tribute to the science that had been building over the past several decades in healthcare. So the technology is not new. The application of these vaccines are new. Absolutely, these vaccines, anything approved by the FDA, is absolutely safe. For over 100,000 individuals part of these studies, there have not been a single death. People are dying from COVID, though. Again, concern about how fast these vaccines were developed, this was building a technology that exists. RNAs are different than DNAs. RNA does not affect your genetic profiles, and probably these are one of the safest vaccines ever developed in the history of the world.
Thank you. Dr. Haddad, how do these vaccines work, and what is the difference between them?
Vaccines are designed to protect the recipient, and different vaccines have different mechanisms of action. These particular vaccines were designed to, most importantly, lessen the risk of disease, lessen the risk of hospitalization, as well as almost reduce to zero the risk of death. Up to this moment, we think that some people may still get asymptomatic COVID carriage for a short period of time if they're vaccinated, but that goes on without any negative sequelae. So again, different vaccines work differently. The COVID vaccines so far have had a tremendous effect, a very positive effect on the course of disease, severity, hospitalization, and most importantly, risk of death from COVID-19.
Thank you. Dr. Pruitt, why have there been so many challenges on a national level with the rollout of vaccines?
When they first started making vaccines, there was a challenge because there just wasn't enough vaccines available. And so what we had to do is prioritize who gets the vaccines first. And we wanted to make sure that the people that are taking care of sick people got it first. So those were our healthcare workers. And then we made sure also the people who were dying most often, which are people in nursing homes, they also were high priority. And then we went down the prioritization list. You could see very early, very few people besides healthcare workers and people in nursing homes got the vaccine. But you can see more and more vaccines are becoming available, and we're starting to open up the range of people who can get it. So right now, people who are 16 plus with chronic conditions can get them, and everyone above 16 can get the vaccine now. So the reason why is because we have more. So in the beginning, it was scarce. Now there's more, which means more people can get it.
Is one vaccine more effective than another? Should I be checking to see what kind of vaccine I'm going to get?
I always say that one vaccine is not better than the other. The vaccine that is offered to you is the best one at that time. So if you can get a vaccine, go ahead and get it. I think some of them have more strengths than the other in different ways. But I would say in general, the vaccine that is offered to you is the best one to get.
Dr. Kakano, does that advice carry across different age groups? Or so, for example, is a 16-year-old in the same category as a 65-year-old in terms of what vaccine they should take?
All three vaccines that have been approved under the Emergency Utilization Act by the FDA have been studied in individuals 16 plus. Same three manufacturers are about to start their studies from infant to 16s. So the safety on 16 to 80 to 90, irrespective of gender, ethnicity, the data is absolutely, they're effective, they're safe. Like Dr. Pruitt said, any vaccine is better than no vaccine at this point, 16 plus, but the studies are starting for infants to young adulthood.
Dr. Haddad, are the vaccines effective in providing protection for the new variants?
There are current evidence lines from basic studies, serological studies. The clinical correlates of that are still being looked at. The quick answer to your question, Kate, about efficacy against the variants is yes, very likely. We don't have a final answer yet, but we know that both Pfizer and Moderna's vaccines are effective against both the English or the UK variant, which is 117, and partly against the Brazilian variant, P1. We suspect they might be less effective against the South African variant, 351.1. So with all that said, it should not sway anybody from getting them with concerns about them carrying a specific variant. We know that even in variants, we have enough evidence that they do work, and at least by decreasing the severity of disease, and like I said before, the risk of death. So the quick answer is yes. More details coming as we have more studies unraveling as we go.
So Dr. Kakano, we know that this has been developing and fluid over the last year. Do we know how long the vaccines will provide protection?
So it's too early to know. It's too early to do so. Vaccines have been around, approved by the FDA in December, and one in early February. The studies that started June and July last years, we know that most of these individuals still have some level of immunity. Who knows? I do not have a crystal ball, but more likely than not, we will be requiring a booster at some point. Whether that booster, as you can see in the flu shot, the booster is a yearly booster for the flu. For the polio shot, it's a lifetime shot. So what the literature is saying at this point, maybe between 1 or 2 years, most of us going to need a booster for that COVID vaccine.
Dr. Haddad, historically, have there been other vaccines that have been approved for emergency use in the U.S.?
Not that I'm aware of, and a quick review of the literature shows not. But I think I would like to bank on what Dr. Kakano had just mentioned as well, that even the EUA that was approved, it does not mean cutting corners at all. So let's focus on the current situation and reassure everybody that all safety steps have been very well taken during the design and the studies of those vaccines, from the basic bench work to the animal studies, and finally to the human studies. So far, we have in the study, in the initial trials, at least 70,000 people studied head-to-head with placebo versus the vaccine. And by now, we have 130 million doses of vaccination administered in the United States with almost no unexpected side effects. No risk of death like people were concerned about, no risk of in pregnancy or for fertility so far. Yes, it's a short period of time, but the volume of the vaccines is very reassuring. So even that it had been an EUA process, no safety shortcuts were taken, all the studies were checked. And finally, I think the approval by the FDA is testament enough on their safety and on their efficacy. I think that really summarizes all of the concerns about EUA.
Dr. Kakano, is there anything you'd like to add? I'm going to give you what one person wrote. One person said, I'm worried about my family, some of whom are considered at risk. They are extremely wary of the vaccine and actually believe there is less risk from the virus. How can I best guide them?
Okay. Education, education, education. People are dying from COVID. People are staying in the hospital from COVID. A large percentage of individuals who are healthy, this is adults and these are kids. This is pregnant and non-pregnant women are having long-term side effects from COVID. We've seen kids who come with heart problem with COVID. We've seen kids coming up with multi-system failures. We've seen adults with what we're calling now a COVID fog. I mean, they have cognitive deficit that lasts with them. So the adverse effect, that COVID-19 variant is not a simple cold. It's not a flu. You can have long-term sequelae from this. So if your family members are concerned about it, you do not want having a loved one and they get with a stroke, with a heart issue, with cognitive deficit for the rest of their life. If you're going to get a side effect from that vaccine, it's going to be minimal. It's going to be self-limited for 12, 24 hours. Getting COVID, you're putting at risk you're putting yourself and your family, not just only for a death risk, but long-term effects that can last with a child for the rest of their lives. COVID is dangerous. I mean, vaccines can give you some effect 12 to 24 hours after, and that's it.
Okay. So let's move on to some specific safety questions. Dr. Pruitt, we had a few questions about female fertility. Will these vaccines affect current or future fertility?
There is no data that supports that these vaccines cause infertility. This is a myth that is spreading around, and we want all of our young people to know that the vaccine is safe and effective, and it could be very helpful. In a lot of places, like here in Saginaw, 20-year-olds carry the highest number of cases, and so we want our 20 and 30-year-olds to get vaccinated, and also our teens age 16 and up to be vaccinated. So we really want people to know that it is safe and effective. And I have a 17-year-old child, and that I'm going to have vaccinated because I believe in these vaccines.
Thank you. Dr. Haddad, we've also received some questions about autoimmune disorders and the vaccine. Is there data regarding the effect of the COVID-19 vaccines on persons who have autoimmune disease?
So the effect of vaccines on autoimmune disease or immunocompromised patients in general, including cancer patients or even pregnant women, all these data are being collected as we speak. We need to remember the context of the pandemic. It started a year ago. We are way ahead of what we would have expected by now. So there are data that are still lacking. Some of those data are the effect on immunocompromising conditions, including autoimmune disease. However, the general thinking and conviction in our medical community is that it is way better to get vaccinated with the tiny risks that the vaccines have, tiny, negligible, resolvable risks, versus, for example, getting the vaccine, the COVID disease itself, because that's a really bad situation. We see it, as Dr. Scicano and Pruitt had mentioned. We're seeing those cases. We see how complex they are, how risky it is for their own lives. So anybody with these compromising conditions would be way worse off than anybody else. These are the people who should, in fact, get vaccinated, not shy away from vaccination. So the data are lacking still, but we believe that the data would support anyone getting vaccinated very soon.
Thank you. Dr. Pruitt, we also had a question, well, several questions about vaccine safety and food or medicine allergies. So what should people who have these types of allergies know before they become vaccinated?
So most people with allergies do well. And if you have an allergy and have no major side effect like angioedema, which is swelling of the tongue and the lips, or swelling anywhere from any of your allergies, or if you carry an EpiPen, what we do is ask that question on the consent when you first come in. And if you do have that and it's not severe, we can watch you. But for those who have had like severe reaction, shortness of breath, heart palpitations or anything like that, plus the swelling, we tell you not to get the Moderna and Pfizer vaccine, and you may be a candidate for Johnson & Johnson. If you have a minor reaction, we'll just watch you a little longer after you get the vaccine, just to monitor you to make sure you're okay. But if you have major reactions, serious reactions after having vaccines, or you carry EpiPen, we think that you should wait for Pfizer and Moderna.
So, in a follow-up to that, Dr. Pruitt, one person asked, should people with these types of allergies have their vaccines administered in a medical facility as opposed to something like a drive-through clinic?
It just depends. I would say some drive-through clinics have medical personnel there giving those vaccines. And so there will be physicians, nurses. For every vaccine provider that provides vaccine, they have to have epinephrine there. They have to have Benadryl there to be ready to treat patients who have an allergic reaction. At the health department, I have done many people. We've had many vaccine clinics. And so far, we've only had to send 2 people to the hospital. And one, I believe, was for an anxiety attack more than having a reaction to the vaccine. So most medical providers are there to help for any kind of allergic reaction that you have, even in drive-throughs. In the drive-through clinics, you still wait for 15 minutes to be monitored. And we usually have either EMS or some kind of medical personnel outside waiting. Now, would it be safer to have it in the hospital? Of course. But if that's not an option for you, based on the requirements of being a vaccinated provider, you have to monitor the patients for 15 minutes after getting the vaccine.
Okay. In addition, Kate, if I may add to what Dr. Pro just mentioned, anybody who has risk, we're increasing the duration from 15 to 30 minutes just to cover any potential risk for that. So,
very good. So, Dr. Cacano, how will this vaccination effort that's ongoing at CMU right now, but what is that going to look like when we really open this up to many more people and larger age groups?
As vaccines become available, like Dr. Pruitt mentioned earlier, we have an opportunity to vaccinate any 16 plus, irrespective of chronic conditions, medical risks, which is a great thing to mitigate or combat this huge pandemic that affected the whole world, not just the US. It's a matter of building the infrastructure for it, having the infrastructure of resources, screening these individuals before they come, having the staff, whether these, and most of the staff actually has been volunteer staff in the region, which is amazing. Building that infrastructure, communicating to our community that these are the resources available, please register, come. So we've learned a lot over the past 3 months, and we are at a good point. Currently, we are at a good point in terms of knowing how to deliver these vaccines, how to communicate, and how to make sure they're given in a safe manner.
Will an employee's family be able to get their vaccinations at CMU?
I would say at this point, there are plenty of vaccines available. Register, get it when you can. Health department, pharmacy, physician office, CMU, wherever you can get it, as long as it is an approved clinic by the health department, an approved vaccine, any of the 3, get it anywhere you can. Any vaccine, anywhere is better than no vaccine.
Great. So we're going to move now to what happens as we get the vaccines, and I'm going to begin with Dr. Haddad. The question we received was, if I have already had COVID-19, why do I need to be vaccinated?
So patients who had COVID-19, we know that they are protected for a short period of time, at least 3 to 6 months, based on many studies so far. But we're concerned that the level of natural immunity wanes off with time. So the vaccine would act as a really nice booster to increase this level of immunity and bridge them for a longer period of time. So currently the recommendation is anybody who has had COVID, wait until they recover completely, which is usually 10 days after the onset of COVID, and then they should consider being vaccinated. In the United States, because we're fortunate enough to live in the United States and have enough vaccine, people can get it after 10 days. I can tell you in other parts of the world, people are waiting a couple, 3 months, and that's a personal decision one can take. Because we know they're protected for that much time, but after that, would definitely recommend a booster, 1 or 2 doses, to increase the level of protection for a longer period of time.
Okay. So, Dr. Pruitt, do you recommend people take Tylenol before or after a vaccine, and under what conditions?
The CDC doesn't recommend anyone taking medications prior to the vaccine. And afterwards, if you begin to have some complications, i.e. fever, if you start to have severe soreness, sometimes you have body aches, muscle aches, and if they're difficult to tolerate, you could take Tylenol or Motrin to help with that, to help with some of the symptoms. But the majority of people, like Dr. Cacano says, have symptoms for 12, 24, 48 hours after having the vaccine, and they should resolve on their own. But some people can have fever, and it can be uncomfortable and high. If you want to take that or any of the other symptoms, you could take Motrin or Tylenol.
Okay. So, Dr. Haddad, this question came in. If I have an adverse reaction to the first dose of a vaccine, should I take the second dose?
So if somebody has an adverse reaction, it depends on what it is. If it is mild, as we've discussed, muscle aches, headache, fever, chills, these general symptoms common with other vaccines, these are okay. They go away, they don't stay for long, they're treatable. But if it's a serious side effect, such as what we call anaphylaxis or really severe allergic reaction, then that's something to be taken seriously. Luckily, this is very, very rare. 3 to 5 cases every 1 million doses, very rare. The other side effects we all are talking about are rather common, and they're very treatable. So the short answer would be yes, if they are common side effects that occur after the first dose.
Okay. And a follow-up question that we're receiving, I think, from students is, if I receive a 2-dose vaccine, so I get my first dose, and I cannot take the second dose on the exact schedule, whether that's 3 or 4 weeks later, will I be able to push back the second dose, and how long can I wait?
The second dose, or in any of the 2 vaccines approved in the United States, can be safely postponed a few days. The CDC says plus or minus 4 days, but practically speaking, if that is not within that period of time, it's going to be okay. So the answer would be yes, they can resume the second dose, no need to restart the series whatsoever. Anytime after the first dose, the second dose can be given, even if it's delayed.
Okay.
And can I add one thing to that too?
Yes, please.
For up to the CDC says, you want to get it closest to the date that you were originally told to come in. But if you can't, it could be up to 42 days or 6 weeks. And then you definitely can get that second dose. So you want to get in a time period that Dr. Haddad said, but they do leave a little bit of room for getting that dose. You don't want to wait very long. So get it as close to the date, your return date, as you should.
Okay. So we've talked a little bit about these side effects, and Dr. Cacano, I'm going to ask you to kind of wrap it up for us about the short-term side effects from the vaccine. One of the questions specifically that we've received are the side effects for the second dose worse than for the first dose? And how does that work? And what give us a summary of what people can expect?
So again, one more time, all 3 vaccines available, Pfizer, Moderna, J&J in this country, they are absolutely safe. A small percentage of the population gets some side effects, soreness, fever, aches, possible headache. We've seen more side effects after the second dose, not the first dose. What that means that your body is building an immune system. You're building immunity against that COVID-19. These side effects are self-resolve with no sequelae, with no long-term effects within 24 to 48 hours. So unless you have a severe allergic reaction, like Dr. Haddad mentioned, which is 3 in a million, take the second dose. They are safe, irrespective of gender, ethnic background, age group 16 plus. Vaccines are safe. There have not been a single death, either from the study or 3 months of experience vaccinating 35 million people in this country. Not a single death. 35 million people vaccinated in the US so far.
Thank you, Dr. Milano. Dr. Pruitt, there were a few questions about long-term side effects from these vaccinations. Can you talk a little bit about how do we know? How do we know if there are long-term side effects?
So as my colleague said on this call, studies are ongoing right now, but we don't know 100% what the long-term side effects are until we finish these studies and watch and see what happens. So the answer is we don't know just yet what they are. We can see some things happen in some people, but in general, they're safe. And we'll keep monitoring and doing studies for people so they'll know what they are long-term. Remember that COVID-19 is like a 1-year-old baby, right? So you don't know a lot about it right now. And so we're still learning. The more we know, the more we can give to everyone. But right now, we really just don't know.
Okay.
Kate, if I may add to this concern, I completely agree with Dr. Pruitt. There's no way to know or read into the future. Historically, long-term side effects or serious long-term side effects from vaccines is almost not there. None of the previous vaccines, even the issue of the measles vaccine and autism has been refuted several times. So we know that long-term side effects do not exist. We need to weigh that even if we have an esoteric uncommon side effect come down the road, 1 in a million doses or whatever rare side effect, we need to weigh it in the context of the pandemic. Without vaccination, think about this. If all the United States gets COVID-19, 400 million, we would have 8 million deaths. I think that's an impressive number that we need to uphold and take up vaccination and encourage it to prevent more deaths coming without the vaccine.
Thank you, Dr. Haddad. That's really helpful perspective, I think, for our audience. So we get the vaccine. Dr. Pruitt, why do people still have to wear masks after they're vaccinated?
Yeah. So there is some concerns, like Dr. Haddad said a little bit earlier, about some colonization that you could be a carrier of COVID-19 after you get the vaccine, which means you're yourself healthy, but you could potentially spread COVID-19 to another person. And so we ask people to wear their masks so that wouldn't happen. We know that this is probably rare that this has happened, very probably unlikely, but we still want people to wear their mask until the majority of us actually can be vaccinated. You know, new guidance came out that said that 2 people who are both vaccinated can interact with each other after they've, had both doses, and then 2 weeks later, or the 1 J&J dose, and then 2 weeks later, can interact with each other with no mask. But in general, you should, when you go out in public, you should be wearing your mask so that you wouldn't spread COVID-19 to another person.
So, Dr. Haddad, as people are getting a little bit tired of being confined, one question came in is after I have the vaccine, is it safe for me to fly in an airplane?
So the answer about any risk is we still have some risk. Whatever we do, there will be some risk. It's not going to be zero. But somebody who has gotten fully vaccinated, meaning 2 weeks after the second shot or 4 weeks after the Johnson & Johnson, they are way safer than somebody who has not been vaccinated. So the answer would be yes, they can fly, but continue to be careful. What that means is avoid indoors close gatherings with others, because as Dr. Pruitt, we want to avoid transmitting it to others who are vulnerable, who have not been vaccinated. The short answer is yes, they can fly, but continue to be vigilant, continue to understand the risk involved. It's not going to ever be zero risk, but much better right now than we had a few months ago.
Okay. I think this question was asked in a variety of different ways. And so, Dr. Pruitt, I'm going to circle back to you. If I have underlying health conditions, I am vaccinated, and I have extended family who are not vaccinated, is it safe for me to visit them? And I think what people are getting at is, if I'm vaccinated, am I protected enough?
If you're vaccinated, you can visit your family members, yes. And then you do have some protection there. I still recommend, because I'm not for sure in this scenario, the family members are not vaccinated, correct? And so when you go into this scenario, you want to make sure that you're wearing your mask. These your family members should be wearing their mask too. And I would recommend, because they're unvaccinated, you definitely don't want to give anything to them, that you maintain your 6 feet distance, but you could go visit your family members, yes.
Great, thank you. We've already covered booster shots and not knowing exactly when we may need them. Dr. Haddad, is there any data now that there's a difference between the vaccines and the amount of long-term protection they provide?
So data about long-term protection, Kate, is severely limited by the duration, by the natural history of this pandemic. As Dr. Pruitt said, this is a baby pandemic. We were struggling with it just a year ago. So it's a year old. We simply do not have the timelines to answer that question.
Okay. You know, I'm going to give Dr. Kakano the last word, because we did get this one question that I greatly appreciated. The question is there a possibility I might get superpowers with this shot? I'm hoping for super speed like the Flash.
Yes, you do. Get your vaccine. You're going to be immune. We're going to beat that pandemic. We have 500,000 people died so far. This is more than 3 wars in a whole century. Yes, you're going to get superpower. You get that shot in the arm. You have your friends take it. You have your family take it. We're going to beat that pandemic. We are resilient. We have grit, and we're going to win.
Thank you. So thank you to Dr. Kakano, Dr. Pruitt, and Dr. Haddad. And thank you, the viewers, for joining us. For more information about CMU's response to COVID-19, please visit cmus.edu and click on Fired Up for Spring. Thank you.